right, ladies and gentlemen, today we have visiting consultant, Dr. Stephanie Ho. Come, let's welcome Dr. Ho. Hi. Dr. Stephanie Ho is not new to Dr. Low Lee Talkshow. Actually, because of popular demand, we got her back again.
Thank
the
you
last
very
time
much.
we had a talk on what? Hair loss, right?
Hair loss,
and
yes.
too much hair, am I right? And who was here last at the talk show? You enjoyed the session? Do you grow more hair after that? No? Or you lost more hair? Okay, Dr. Stephanie Ho is actually a private skin specialist. Is practicing in
Pacific Plaza.
Pacific Plaza,
Yeah.
all right. And you are a foreign grad, right?
Yes, I was trained in the UK.
Yeah, would you like to tell the audience, because some of them may not have met you before?
Yeah.
You know?
Hi. Hello. Okay. So I'm Dr. Ho. I am a dermatologist. So I'm a skin specialist. I was trained in the UK. I've worked in Hong Kong for several years, and over the last 4 years, I came back to Singapore, and I've now set up my own private practice in Pacific Plaza. So I do see a lot of patients with medical skin conditions, as well as maybe other aesthetic problems, or if they need some sort of screening for unusual atypical moles and things, we do all of that, yeah.
I see. Okay, Dr. Ho, today we're talking about eczema.
Yep.
I'd like you to share more about, this condition basically. I used to practice medicine, and I know that people, eczema, they really suffer.
Yeah.
And it's quite confusing, and even as a medical student, I was very confused by the word eczema.
Actually, eczema is like an all-encompassing term that encompasses all these different types of skin conditions. And basically, eczema is a chronic itchy skin conditions, and you see it very often in children, but it can happen at any age. And very often we call it atopic eczema. Atopic meaning the person has a predisposition to having a hypersensitivity sort of conditions. So a person with eczema very often, like the patient here earlier, will have also sensitive nose or sensitive lungs, so giving them allergic rhinitis or asthma. And these conditions often run in families, so they may have a parent or a brother or sister with the same type of conditions, and that's one of the clues we always look for when we are, and when we are kind of looking at a patient with an itchy skin condition. Yeah.
So you have talked quite broadly about atopic eczema, but I was trying to ask you more on why are there so many terms like, dermatitis, allergic dermatitis, contact dermatitis. What are these actually? How is it different from eczema?
Eczema, you can broadly divide it into atopic eczema, which is when there's a hypersensitive skin condition. You can have irritant contact dermatitis, where any of us can get irritant contact dermatitis. So you get something that looks like eczema, but is caused by repeated exposure to like a chemical or soaps or detergents.
What kind of chemical do we normally get exposed to?
Just washing hands. Some people who wash it, if any of us in this room wash our hands 100 times a day, we will all have hand eczema.
So you are saying that if I wash my hands 100 times a day, I will get eczema?
You'll get
Anybody wash your hands
eczema.
100 times a day? Hardly, right? But there are people who are obsessed. But on the other hand, they're also exposed to, detergents, washing.
Yeah, if people who are doing certain jobs, may be exposed to detergents, cleaning.
Housewife, washing.
Housewives,
right?
or people
So
with
housewife,
restaurants.
tell your husband, I'm not going to do any more washing because I may get dermatitis, right?
Yeah,
eczema.
exactly, yes.
Good excuse. So for this group of people, what kind of advice you give them to prevent this kind of eczema, this kind of condition?
People with hand eczema, yes. Mainly we tell them to try to cut back if they can, and to double gloves when they are doing the housework, so that they reduce their contact with these irritants. Usually it will be the food they're coming into contact with, the detergents, cleaning fluids, and so on.
Certain food, actually, you just mentioned, can cause eczema. Is that what you're saying?
Yes, if you're touching raw food all the time.
Raw food.
If your skin is broken and you expose it to, say, fruits, like, citrus fruits, like lemons, oranges, and things, it will definitely make it sting and make it worse. And, it doesn't give the skin a chance to heal.
So all this contact, even with fruits, can cause you to have dermatitis or eczema, basically. Yeah. Some people, eczema, you can see they basically the skin seems to be very rough, very, very raw, and some of them very dark. Why is that so?
Yeah, so with eczema, they often, present with very red, inflamed, itchy skin. And if there's any sort of overlying infection, they might even be like weepy, so there's like fluid coming out.
Some fluid coming out.
Yeah, and in Chinese people, anytime you have any sort of red rashes, it always heals, leaving a brown mark. That's just the way we are, because we've got melanin in our skin.
That's only happened in Chinese. Why is it so? Why not? I mean, the Indians don't get that problem.
Well, anyone, Chinese, Malays, Indians, Asians, basically, with more melanin in the skin, you tend, when your inflammatory skin condition recovers, you will usually have some sort of dark mark there.
So, is it worse, let's say, if because you got eczema, you start scratching, does it make you more like predisposed, more prone to getting this pigmentation on dark skin?
No. If you have eczema, you will, when it recovers, you'll get this kind of skin discoloration. When you scratch the eczema, of course, we do not, we try to reduce that, because you then have broken skin areas, and that's when, bacteria, viruses can then go into the skin and cause all sorts of problems and make the eczema much worse. Yeah.
See. So there are many different kinds of eczema, and some people use the word dermatitis. Some are like what Dr. Ho said, due to contact with chemicals. Some are due to allergy.
That's right. Sometimes
allergy to what kind of things? I mean,
the commonest would be nickel. So like nickel.
That's an interesting thing. And all of you, put up your left or right hand and show me you wear a watch.
Yeah.
Okay. Do you know that your watch actually contains a lot of what? Nickel as well.
Yes.
And in some of you, your spectacle also got nickel. That's why I don't wear a metallic frame. And you look at it, some of them actually have rashes, right?
Yeah, that's right.
By the ear there.
So it's very localized where they touch the metal.
And sometimes you wear watches, you get itchy there. I used to wear a metallic watch, and I always get itch. That is caused by nickel, right?
Nickel contact allergy,
you get allergic dermatitis.
Allergic contact dermatitis, exactly.
So when you have that condition, do you advise them to continue wearing or wash their hand?
So the easiest thing is to stop wearing that thing, anything with nickel, so costume jewelry, watches, even the metal belt buckles.
Belt, that's right. Ladies, go back, examine your husband. You can see some of them got this little patch here due to the belt.
Around the belly button,
And you look at some hawkers, okay? They go home, they have this little patch here. And last time used to be the bus conductor. You know why? Because they used to put all the coins inside the pocket. And when they sweat the coin, dissolve the nickel and chemical, it passes through the pants, and then you got all these patches on the skin. That's how you get it. So you can actually be a good detective, okay, that this person has allergic dermatitis because he used to put a lot of coins in the pants. That's interesting. Let's go to the topic called eczema itself. This is the topic for discussion today. How do we live a topic eczema? First of all, the word eczema actually comes from a Greek word two Greek words called ek and jing. Ek means basically like outburst. The other one is like flare up. So that's how the word combined come up in Latin word become eczema today. And today we want to cover this topic because a lot of people do suffer from this condition. And Dr. Ho just mentioned that you can start off with children, right?
Yes, it's very common in children. So actually, large majority of patients with eczema present before the age of 1.
Before the age of 1?
Before the age of 1, yeah.
Why is that so? I mean, why so early they suffer already,
In that
they're not even exposed to...
Yeah, well, the immune system is probably quite immature at that time. And, they can be more hypersensitive to any irritants or allergens in the environment.
So you are saying that it's because the immune system is not mature. So therefore, when they're exposed to chemical, they tend to overreact. Is that what you're saying?
Possibly, and also they already have a hypersensitive immune system from a genetic cause usually.
And just now you also mentioned that these people also have a lung problem, and then the lady has
asthma. They may have
Why
asthma.
is that so actually?
Basically, your immune cells, is all over your body, and these are the areas that the immune cells are a little bit more hypersensitive. So we do always see patients with this, we call it a triad of asthma, eczema, and sensitive nose, allergic rhinitis or sinusitis, some people call it. And it runs in families. If you have two parents with one of these conditions, the likelihood of you having eczema is a lot higher than if you do not have any family history of anyone with eczema.
So primarily due to the genes?
Correct, yes.
Okay. So if you're born with it, basically, it's genetic. Basically, you can't blame anybody. It's just passed down the genes. All right. And you can look at the picture. There are different type, atopic eczema. Some people just feel a bit of scratches, but some of them, you look at the picture, can be quite scary, right? I mean, it's like raw, it's dark, pigmentations, and very red. Some of them get infected. So people with eczema actually suffer quite a lot. There's a lot of myth about eczema, you know that. I got patients told me that because she got eczema, the relative dare not go near them. You know, it's very sad because people think that just because you got skin problem, they relate this to something infectious. And that's something that I hope you will, after today's the Low Lee Talk Show, realize that eczema is not contagious. And if your loved one, your friend, your colleagues in the office have eczema, please don't run away, okay? You hurt their feeling, and it's irrational because eczema will not, it's not contagious, okay? It passed down the genes most of the time, but it doesn't spread. So the message, remember, today is it's not contagious, so don't, and then if you happen to, young couple, if you happen to produce a child who come out with this kind of rashes like that, don't get scared of holding the baby. Okay, I've seen mothers, because they think the child got all this kind of infection, they're not hold the baby. That's very unfortunate. You can see, and people do suffer. So you can see that, it's not painful, but it gives the person a lot of very uncomfortable, unpleasant feeling, and they suffer. So I hope today, after the talk show, you learn from Dr. Ho, we become more compassionate, we understand this group of people better. You mentioned that, Dr. Ho, that genes is probably one of the key factors. Are there any other factors that could have caused it?
Yeah, actually, eczema is quite a complex condition, and apart from genetics, the environments also come into play. So when I say genetics, actually we now know that a lot of patients with eczema have this deficiency in a protein called filaggrin, and filaggrin is a protein in the outermost layer of our skin. And when you have a deficient filaggrin, the skin barrier, the skin works as a barrier, doesn't work so well anymore. So it makes the skin more susceptible to irritants and allergens such as house dust mites, grass, pollen, or even sweat, dust, and things like that. Yeah, so that's the interplay of genetic and environmental factors.
So because of your gene makeup, your skin has less protection, so you're more prone to all this exposure to irritants like what, dust mites, right?
House dust mites, is a common
pollen.
one. Pollen, moles, grasses.
Moles, okay.
Some people can be allergic to their dogs or cats, and it's always a difficult conversation to have.
So these people, therefore, get rid of their dogs and cats?
They often don't.
They often don't.
They often don't, actually.
So they prefer to just scratch and hug the dog and continue?
They kind of, from what I can understand, they kind of say, okay, the dog has to live in the kitchen or live somewhere else. But still, the dog hair.
Then what's the point of having a pet when you cannot hug the pet?
But some people's dogs are very, it's part of the family.
Emotional attachment. Yes. So they rather scratch and still continue the dogs and cats relationship, right? Well, how about food-wise? I mean, are they
yes,
food that can cause
definitely. Well, food allergy, everyone comes in, saying, is the prawn I'm eating or something. And we understand that in adults, actually, eczema due to food allergy is very, very rare. But in young children, we do see it quite often. So in children less than 5.
But young children, like 1 year old, young baby, they don't even eat anything. So what could they be allergic to? We don't test at so young, because they don't like us after. Or could it be they're allergic to their mother's milk?
If the mothers are eating something that the child is allergic to, yes, potentially that can be a problem.
Or even the cow's milk, could that be a cause as well?
Yes, cow's milk can be a cause as well. So if you cannot
take mother's milk, cannot take cow's milk as a poor baby, what do you take?
They have got other sort of hypoallergenic
right. So they
milk.
take soy formula, that's right. So they're alternative, fortunately.
Yes, that's right.
Okay. There's a very experienced asthma patient and an experienced mother as well, and an experienced pediatrician.
Well, luckily now there's these hypoallergenic formulas where it's made from cow's milk, but it's been extensively hydrolyzed, so the protein is very, very small, so the body doesn't actually recognize it as cow's milk protein. So they give that to these children with problems with cow's milk, but it's very expensive.
So there are alternatives for the babies with eczema. I heard that your own sweat also can trigger the eczema attack.
I think, a patient with eczema, they are often triggered by sweat, hot and sweaty conditions, dusty conditions. If their neighbor is renovating, sometimes they flare up, unfortunately. Yeah.
How about smoking? Does the smoking cause you to have a flare-up atopic eczema?
I don't think there are any huge studies, but smoking
maybe
is
from
bad
the smoke itself,
yeah.
the smoke, the
Maybe,
pollutants
possibly,
itself,
yeah.
possible. Let's go on to the next slide. Let's talk about the triggers, basically, of eczema, basically. A lady like her, hadn't got an attack for a long time, but then there are patients who suddenly move to a new house, they got, eczema flare-up, or they are in a certain environment, they get eczema flare-up. So we talk about the trigger. What are the common triggers why people get the flare-up eczema?
So common triggers, as I said, it can be heat, sweat, dust. It could be, house dust mites in the environment is one of the things we try to ask patients
house
to
mites,
reduce.
that's a good question. How do you propose that we get rid of house mites?
Okay, so house dust mites is often in carpets, in curtains. Yeah, so we try
people
to.
eczema should get rid of carpet. Are you saying?
Have wooden floors, yes, and try
have
to
wooden
reduce.
floor.
Yeah.
Okay.
So it's easier to
but
clean.
But their bed also got mites.
Yes, that's right.
So should they get rid of the bed as well? and should they sleep on a wooden floor?
Luckily, there are now these mattress protectors and pillow protectors that actually, help to reduce.
So you're selling pillows and mattresses that are hypoallergic now. All right. And now you're expert in anti-dust mite as well. Wow. Okay. You are expert in many things, all right. So basically, house mites is a cause of a lot of problems. Asthma and atopic eczema as well. And you recommend people to get rid of carpet, and you're saying that, the mattress, you can get rid of it, but buy the more expensive type, right? The
you just have to
hypoallergic
buy
one.
a protector. You can buy whatever mattress you want, yeah.
Do you recommend actually your patient to go vacuum the whole house and vacuum your bed? I know that there are people
there
sell
are some people who sell some funky vacuum cleaners. Yes, there are. You just be sensible. Try to make it clean, as dust-free as possible. So I generally say no rugs, no carpets. If they have young children, I tell them to remove all the soft toys, because soft toys are a dust magnet. So
how about the clothing that you wear? I mean,
you wash them, right?
you wash
Most
them.
people
But then when you wash them, you got problem. You now got exposed to all the detergents that left over because you didn't rinse off all the detergents.
So some people have a double rinse, and so
double rinse.
Yeah.
Wow. Okay.
Well, I think some people who are very particular, they might go to all the extent. But usually, we just tell them to keep cool and dry. Try to reduce the dust load in the house, and also what they can do is when they are showering and things, to use some gentle soap-free cleansers. That's very important.
That's right.
Actually.
Don't use strong soap.
Yeah, don't use strong soaps.
There are lots of patients I know who think that because they got eczema, they think it's infection, they are dirty, so they tend to shower, not just more often, but use a stronger soap. They use those, I always tell them, this kind of soap that you use, I shouldn't mention the brand. Okay? I told the patient, this kind of soap is meant to wash the toilet bowl. Okay? Your skin is not that dirty, and eczema most of the time is not infection. You don't need such a strong soap. So like Dr. Ho said, just use a mild soap, right?
Yes, use a mild, gentle, soap-free cleanser. And then you need to ask them to moisturize all the time.
Should they use cold or hot water to bathe?
Lukewarm water, not too hot, yeah.
Why? What's wrong with having hot water to bathe? I mean, a lot of Chinese, we were told, grow up, must bathe in hot water, otherwise feng shui and all that, rheumatism.
Yeah, so lukewarm water, so a little bit warm.
It's more comfortable.
It's more comfortable for the patient, and it's not so drying for the skin.
That's right, because hot water actually can get rid of the oil on the skin, and you actually scratch more. In fact, when I go to a winter country, I try not to bathe in the morning before I go out. There are people who bathe in the morning when they go out because they feel clean. I don't know why. They feel that sleeping on the bed is dirty. And then when you do that, you actually get rid of the layer of oil that accumulate over the night. And then if you're in winter country, you need the oil. You need the moisturizer, otherwise you get itchy skin. That's why when you come back from a winter country, you always scratch and scratch and scratch, right? So don't bathe, and be so vigorous and aggressive and get rid of all this oil. You need that. You get dry skin, you scratch and scratch.
I often do tell my patients if they are going somewhere cold to change the moisturizers they use, because what they use in Singapore might not actually be suitable for them
Why
when
do you
they're
say that?
abroad.
That's an interesting point as well. I'll get it back to you.
Yeah, that's
What's the difference between
because
the moisturizer?
normally in Singapore, where it's very hot and humid, we would prescribe creams.
Creams, okay.
But in a very cold temperate country, we tend to give ointments. So
The oily
so
type,
it's
the oily type,
the
that's
oily
right.
type of moisturizers, and even the oily type of steroids, so the treatment medicines to apply, and that kind of keeps the moisture in. It just helps them much more. And if you can preempt that, you can hopefully prevent them from having a flare whilst they're on holiday, which will kind of ruin the holiday.
That's absolutely right. In fact, when I go for a winter country holiday, I'll actually use an oil-based moisturizer because I find that lotion doesn't really work. And you find that it's always more itchy on the leg for some reason, because I suppose cold air descends to the floor, because of gravity. So I think you can put all this, it helps. Otherwise you scratch and scratch. And when you scratch, then you think of this patient with eczema. Then you know how it's like to suffer, right? It's terrible, they scratch the whole life. And you only scratch after a winter holiday, and you enjoy yourself, so now you got to pay a price for it. So how about smoking? You should also avoid smoking as well, because of the pollutant. And I also heard that certain kind of fabric, wool and some, right? They also cause that.
That's right.
So they have to go to this departmental store and buy those hypoallergic clothing now?
We normally recommend just cotton, 100% cotton,
right.
Loose, comfortable. Avoid wool or synthetic materials that can be like prickly and cause them discomfort. Yeah.
That's right. You avoid wool and all this synthetic stuff, and you feel more comfortable. Even your bed sheet as well, and your mattresses, all these are important. And of course, when you wash your clothing, don't use all the most expensive, the most powerful detergent. When a patient has eczema, and is not controlled, they actually get into complications, right? What are the complications?
Yeah. So one of the main complications of eczema is when they have infections, and this can come in the form of bacterial infections or viral infections. And it's very important for the doctor who's looking after the patient to be able to recognize these, because if you do not recognize that it's infected and you just give them your usual steroids, it will actually make the skin condition worse. So you have to treat the infection.
So you're saying that if the eczema get infected, you should stop the steroid?
No, you have to treat the infection in addition to treating the eczema together.
And how do the patients know that they actually got infected eczema? Like, are they like different?
The professional patients will know.
Professional, like the lady will know. Do you know? You know?
They will
right.
know, actually, yeah. I mean, the main signs are like when it's weepy, discharging, lots of crusted areas. Pus, yeah. Red, painful. Those are not normal. So we have to work out whether it's a bacterial infection or worse, if it's a viral infection. Because sometimes with herpes infection, you can get eczema herpeticum. It's very serious, and very often patients are admitted into hospital for IV kind of antiviral injections. Yeah.
So let's say if a patient keeps getting infected eczema, are there any underlying reason why that's happening to them? Could it be because they have immunosuppressed? Maybe they have other conditions.
Yeah, it's possible that they may be immunosuppressed. That's why they keep getting recurring infections. Sometimes people may have the bacteria colonizing certain areas of the skin, for example, the nose. So we might swab them to make sure that that's okay. And if there's bacteria in the nose, we'll treat the nose as well. And then gradually they will get better. We give them antiseptic washes and things just for a short period of time, oral antibiotics to get it under control.
And I also know that there are patients because of the eczema, they scratch, and then you find that the skin becomes very thick, very rough, right?
Yeah.
And that's become a chronic problem. So that's where they get chronic eczema.
Yeah, that's chronic dermatitis.
Can that be cured once you become chronic?
Yes, it can be cured. Usually these patients have not seen a doctor for years, and they are always rubbing and scratching at the skin, and therefore the skin thickens in response to a repeated injury. It's trying to protect itself. So with regular moisturizers and treatment, it can be improved. Yeah.
So we talk about treatment of eczema. What are the kind of drugs that you will give to a patient with eczema?
Yeah,
or should they self-medicate?
Oh, definitely not. So most patients would already know that they need to moisturize themselves every day, whether they have a flare of eczema or not. And this is to prevent the eczema from flaring so often.
So you recommend that they
Moisturizer is the it's
because
part of
what?
the treatment.
Dryness? Okay.
Yes. Once you have a good moisturized skin and the outer, your skin barrier is functioning
So does it matter
well.
what kind of moisturizer they use? Like just buy off the pharmacy?
No, well, we do prescribe certain moisturizers, and I think the main things to look out for are those with like glycerin, with
okay.
ceramides in them. These are all hydrating agents that can kind of moisturize as well as repair the skin barrier. Try to avoid any perfume products. Perfume products, any kind of bubble baths, anything with colors in it, just try to avoid it because you have already got sensitive skin, so it's very possible that you may be allergic to these other things as well.
So when you buy a moisturizer, smell it, right? Now you become expert. Wow, now you become expert in moisturizers. Make sure there's no smell because of perfume can make it worse, coloring, right?
Yes.
And when the patient come and see you, other than give them moisturizer and cream, you give steroid cream.
Yeah,
right?
we give a lot of different topical steroids. So steroid cream.
Do you send them for like some form of like phototherapy and all these things?
Sometimes they do go for phototherapy. I mean, if patients are have eczema top to toe, it's not very practical for them to apply creams top to toe.
So what is phototherapy? It's something new to I think the audience. So why don't you tell us what is phototherapy?
Okay, so phototherapy is a treatment where we ask the patient to go 2 times a week and stand in a light box. Okay, so
is it like the one for indoor tanning, that kind of thing?
Similar to it, but it's very controlled. The
different kind of light.
Is a different type of light and is a very specific wavelength, and we know that this wavelength is helpful to patients with eczema. So they literally stand in a light box for only a few minutes. Actually, it's quite fast, and the UV light at that particular wavelength can reduce the inflammation of the skin. So actually, it's very effective treatment for quite a lot of patients. You have to make sure they are not infected before they go in there, or they will get worse. And the eczema is not too severe. When it's quite severe and very red and raw, if you send them for phototherapy, it gets worse. So for those with chronic skin conditions, actually they do quite well with it.
So for chronic problem, all right. And I also know that mothers, actually sometimes wrap their children with wet towels.
Wet wraps,
all that.
Yeah.
Does it really help?
Yes, it does help because we normally recommend what we call wet wraps. So it's like on the hands and legs of children especially. So it's like putting socks with holes on each side. So you just literally...
water.
Yeah. So one layer is wet, damp
That's
rather.
quite contradictory. I mean, that's contradict what my mother told me, you shouldn't sleep with wet clothing,
Yeah, so to pacify your mother, we have a dry layer after the wet layer. Okay, so you put the creams first, and then you have a wet layer and then a dry layer. And throughout the night, it keeps the area moist, it prevents the child from scratching, and it increases the absorption of all the different medicines that you've applied onto the skin as well.
And do you actually prescribe antibiotic, I mean, not just antibiotic, but steroid to patients, oral steroids,
Yes, sometimes we have to prescribe oral steroids to patients with a very severe flare.
When they get very bad.
Yes, just to get it under control.
And do they have to take on a long-term basis or?
That would definitely not be recommended. Usually the steroids are only taken for a couple of weeks at most, and it's to control a flare. If a patient comes in repeatedly to needing oral steroids, then they need to move on to something stronger like oral immunosuppressants.
Patients are very scared of taking steroid. The moment you mention steroid, they think, so scary, so dangerous.
Right.
What is the reason? Why they're so fearful of steroids?
So I think steroids have a rap of causing a lot of problems. It can do if it's taken without monitoring. So things like, it can cause a flare of diabetes, hypertension, it can cause thinning of the skin, it even changes the shape of a person. You can become quite round in the middle and very thin on your limbs, and you may have easy bruising, stretch marks, lots of different things that are not so good for you can happen.
And those people who apply those topical steroid, the cream, do they have this kind of side effect as well?
If you're on very strong steroids for a very long period of time, so don't go to Thailand and buy your own steroids and apply. Don't go to a country where you do not require a prescription and pick up very strong steroids. They may work and you might feel like, I'll just keep applying, and then one day you realize that your skin is thin, you have these broken vessels on them, bruising, and that's because you have not been under monitoring, because we don't give strong steroids for a long time. We give it for a short period of time and then we taper off to something more appropriate in strength. Yeah.
Yes, that's right. Remember, steroids, even when those, for cream itself, actually can cause a lot of side effect complications as well, cause thinning. Can it even be absorbed as well, right, into the body?
Yes, it can potentially be absorbed, especially if you've got a lot of inflamed skin, it's broken skin areas, the absorption can be
then
potentially
you
high.
of complications of
That's
steroids.
right, yeah.
And the worst complication will be like, we call that Cushing syndrome.
That's right, Cushing syndrome, yes.
The tummy, body become round, then the face become moon shape, you don't want to look like that, okay? So don't go to JB and start buying steroids, okay? Go and see a doctor and he'll prescribe accordingly, prescribe the strength appropriately for you. Let's go on to home remedies. It's something that I know doctors like yourself will not like to talk about because for one thing, it's like, why do I want to talk about something that take away my business, right? But, patients do come to me in the past. They say, Doc, should I apply honey on my eczema? Should I apply chamomile or cucumber or aloe vera, even coconut oil or olive? Do this work? Really?
In a nutshell, probably not.
In a nutshell, probably not. Okay. Generally speaking, when we ask doctors all these so-called natural remedies, because doctors basically we go on scientific evidence. But of course, I also know that patients, swear by it. Maybe the expert down there can also tell us whether it works or not. Do you have any experience on these natural remedies?
Not really, because I have 3 kids all having the same, like you said, triad, asthma.
So you experimented all your kids on all these things?
It's very expensive. I mean, to have kids that have this eczema, asthma, and sensitive nose, very expensive to raise. I have gone through. I'm very thankful that you tell them that this eczema thing is non-contagious, because my poor kid, the first kid, she was in primary 1. Everybody avoided because the parents told them not to go near her. So wherever recess, she's alone. Yeah, I have to ask the doctor to write a letter to say that
it's quite
contagious.
Quite sad. That's right.
But
That's
still,
right.
parents are parents. They are afraid because she's like what you saw in the picture, very scary skin, the kind. It's so bad.
So I'm glad you share about this because I think a lot of people here may not even realize that eczema is not contagious. They're so fearful because it looks scary. It looks like, so terrible, so you run away, But let's come back to home remedies. Dr. Ho will base it on science and say that it won't work. And then, of course, as a doctor, I also face this kind of challenge. So as a general rule of thumb, I will tell my patient, okay, if it doesn't cost you arms and leg, and if it's natural stuff, and not going to consume it and get poisoned by it, one cucumber, $2, okay lah, try lah. No harm, Aloe vera, $3, okay lah, try lah,
See, it depends on the severity of the condition. It works for some, it may not work.
That's right. If it's mild one, it helps to soothe your condition by all means, There are lots of so-called articles on some of these things. There are patients who swear by it. Like generally speaking, if it's mild, and it doesn't cost you arms and legs, it's natural stuff, by all means try it. But if it becomes complicated, when you start to see infection and it start to spread, then please go and see a general practitioner. And if the condition get worse, get infected, then they refer to Dr. Ho, and then she will assess it and find out, anything else you can do. Maybe phototherapy, maybe oral steroids. So I would say, okay, we're not against natural remedies. Try it when it's mild, but when it gets worse, that it doesn't seem to be controlled, please see a doctor. That's the best advice we can give you because we cannot base all this on science.
Yeah, and also it's important to note that I think things like aloe vera, cucumber, they're probably very benign. It's okay to try it. But things like apple cider vinegar can make your eczema worse.
That's
okay?
Right.
Things like chamomile, some people are actually allergic to these sort of plant groups. So if you're allergic, then again, it can make it worse. So some of them are okay to try, but some are not. Yeah.
Or Epsom salt,
Actually, I've had patients with salt, rubbing salt all over their rash, hoping to make it better, and actually it makes it
That's
a lot worse.
It's called rubbing salt on your wound. Okay, don't do that. Let's come to this important topic called living with eczema. Like the lady said, she had 3 children, they have bad eczema, and their classmate thinks they are, they're infectious, they run away. So today, after today's talk, Dr. Low Lee's talk show, I hope you go back and spread the message and tell those people, the eczema is not contagious. Don't run away, okay? And if you happen to marry somebody with eczema, okay, learn to love the person more. Learn to be patient. Learn to be sensitive to the person, because it's like, I married this husband, whole life like monkey like that. I feel very, every social function he's always scratch here, scratch that. It's very embarrassing to me. Poor guy is itchy, So if you want to go hawker center, eat, think of him. He cannot take the heat. Go to a restaurant, otherwise you go hawker, eat, chak, It's very irritating. So that's how you help your loved one with eczema, live with eczema. Okay, they are suffering. Okay, it's itchy, they cannot take certain environment like heat, hot, humid place, okay? And don't bring them for a winter country, where they're going to get worse. Okay? This group of people, too cold cannot, too hot also cannot.
I can go, but you have to bring like what Dr. Ho said. You must apply before it flares.
That's a professional.
That's the professional patient.
She's really very good. And I know there are patients who got in depression, right? Because it's quite
they can be
miserable.
very upset. They don't want to go out and see people because they feel that everybody is staring at their skin, especially if it's on a visible area such as the face. It can be very, very debilitating. Children miss a lot of school. They might not be able to. They wake up at night repeatedly because of the itching. They don't sleep well.
They don't sleep well,
so they
right.
might not do well at school. They can miss school, and it can be a problem. So at the end of the day, it's a chronic condition. It's relapsing. It can take a lot of a big toll on the patient as well as the family. Yeah.
So some of them really have a hard time coping, not just at school but work as well. And then
Yes.
if you're employer, you got somebody who happen to
That's
hire
right.
somebody with eczema, be considerate lah. Don't make him go under the fan. Let him have some aircon. A more better environment and not so dusty as well. Maybe find him a room there's no carpet like this. These are things that we can do for this group of patients. So that's how you cope with eczema, really. This is how you really can live with eczema and live with people with eczema as well. So I hope that today's talk show on eczema is useful, and more importantly, having learned so much about eczema, I hope you guys will become expert and help to spread the message as well so that we can help more people. That's what Dr. Low Lee Talk Show is all about. How do we actually have healthy skin? We talk about people with eczema. How about people who are normal, who love to have healthy skin? What is your word of wisdom for this group of people?
Words of wisdom.
Especially for the ladies, they're all waiting for your answer.
Anti-aging, right?
Yeah.
So I think sunscreen is very, very important. I would recommend moisturizing your skin, especially as you get older. Sometimes it becomes more dry. If you can, and you don't have too sensitive skin, use a Retin A type product because it is anti-aging. Eat well, exercise. Have a good night's sleep. These are all ways of kind of ensuring that you have healthy skin.
So exercise, sleep well, eat well, right? Eat lots of fruits, vegetables, and stay cheerful. You look very cheerful, yeah, indeed. And you mentioned something about, sunblock is important. And unfortunately, guys often don't put sunblocks.
Yeah.
How many guys actually bother to put sunblock before they leave the house? I'm the only guy who puts sunblock before I leave the house. Sounds so sissy. That's because I know the danger of sun exposure on your face and your skin, all right? You really don't want to know. It's terrible. People I know who are younger than me but looks like my father. Okay? And when I go out with my classmates, they say, wow, this guy, you sure you're a classmate? You look so old, I look so young. And the reason is because I use sunblock. Sun can cause so much harm on your skin. So don't think you are macho and no need to put sunblock. Please put sunblock. Okay? It's not very expensive. Just a little bit, rub it down. It keep you, protected for the whole day. And more importantly, it also prevent you from getting unnecessary exposure to skin cancer as well, right?
That's right, yeah.
Yeah, and most important of all, in Teochew they say, meaning that if you want to have healthy skin, you must be able to eat. Okay? You must be able to poo. You must be able to sleep. You have all these things, and you're happy, you exercise, eat well, you sure have nice, radiant skin. Okay? With this, yes, you got a question.
Yep, sure.
We know that sunlight produces natural vitamin D, right? So if we were to put UV cream,
Yes.
will it block the sunlight and then...
It's potential. That's a very good question. People often ask that. So if you are very well sun protected, like you said, you could potentially be vitamin D deficient. So actually, a lot of Chinese, Asians, we take a longer time to produce vitamin D even if when we are under the sun. So it is important to just check it. And if you're deficient, just pop a pill. You can take a vitamin D supplement. Yeah, that's a very easy way of topping up.
Thinking like the morning sun.
Yeah.
Going out in the morning sun, we don't apply.
So what some people do is they will protect their face and they'll maybe leave their legs exposed to maybe try to make a little bit of vitamin D, yeah, if you want to do it the natural way. Yeah.
Cover your face but expose your back. That helps. That's why bikinis are made that way, you know. Swimsuits are made that way. The back exposed but the front all protected, you know. Well, I think that's a good point. You can always pop a vitamin D tablet, but it's important to protect against sun damage because it causes a lot of harm. Morning sun, yes, it's not so harsh, especially those before 10 o'clock, right?
Right.
But then there's still UV lights around.
Yeah.
Okay? It's just
in Singapore, you almost have to go before, I think, 8.
Before
and
8, the sun
after
doesn't come
5.
out yet.
You know, in the West, they always go 9 to 3. You stay out away from the sun, but here, there's sun all day.
I see,
right?
okay. All right, now it's a time for a question other than that question. Anyone who has a question for Dr. Ho? No personal private consultation here?
Yep.
My son has got, when he goes under the sun and then he sweats, he always has it here and elbows and then behind the knees. But strangely, when he went to the army, where it's the most dirtiest place and the most sweaty, he never get any, there was no flare-up of eczema.
That's
But
interesting.
when he finished his NS, and then he starts again.
He should sign on to the army. That's my prescription for him. Seriously, that's the best candidate for army.
That's a very unusual history, yeah.
Yeah, recently he said, Mommy, maybe I need the sun.
Yes.
I'm not sure.
I mean, the
I
sun...
agree with her. The sun is important.
The expert agree with her, so we got no more role to play.
I think the sun is important, but too much of anything is not a good thing. Usually, I mean, most people will have their eczema flaring when they are in the army. But again, we also know that a lot of children, they grow out of their eczema as they get older. So it may be a fact that he grew out of it, but then when you said that he gets it back after he goes back to his normal life, that's a little bit unusual. I don't know whether there's something in his environment that might be causing it.
Maybe
Yeah.
he just doesn't like to go to school, that's all. Because there are children who, because they go to school, they get stressed. They don't like school, they get flared out eczema. And maybe army is what he really loves. We have no answer for that. And even the expert also thinks that the sun is good.
Now, of course, not the overexposure, but I think it's good for children also. It's also good for the eyesight.
It's true, it's good for the eyesight. A little bit of sun can help with, that's why we put people in this phototherapy, right? At the end of the day, it's some sort of UV wavelength. So a little bit is fine, but not too much. Yeah, because, sun, as Dr. Low Lee said, causes increases your aging and skin cancer risk and so on. Yeah.
Great. Any more questions? Last question before we invite the next speaker on stage. Anyone? It's your last chance. One more question.
Yeah.
Okay.
I have a contact dermatitis,
Okay.
which is I'm allergic to cutting onions.
Cutting onion, okay.
Yeah. And it's only very strangely, it's only 3 fingers that. So when I hold the onions, no matter how gingerly I hold it, the fumes, even I hold like that, and I cut, the fumes will just get it. So,
And then you get a rash there.
yeah, you always got a permanent black.
Okay, have you tried wearing gloves?
It's very hard to cut onions wearing gloves. You cut, I always cut the gloves.
And no more finger. That's the best. That's the best answer.
You
That's the
found your
best thing.
solution.
Is your husband here, by the way? You know, she's actually not asking the question. She's telling you.
I think what she wants me to say is maybe she doesn't need to do housework. She's not suitable for housework.
So if you don't want to do your housework next time, bring your husband along. You can ask all the questions you want. Okay?
Another thing is get a maid.
That's right.
But then some cooking is, by the time you ask somebody to do the cutting, you just need to cut. You just want to cook it and use it, right? By the time you get somebody to do it, and then it's like so small.
Well, your husband looks very happy. He looks like he's happy cutting onions, so just leave it that way. All right, thank you so much. Let's thank Dr. Stephanie Ho.
Thank you so much.
Yeah. Let's have a take picture together. Come. All right, thank you so much.
Thank you.